So I'm doing strain counterstrain, a technique that I do commonly in the clinic on Heidi here. And basically this is a bit of a different technique. It's a treatment to lymphatics. And yes, that's a little bit different, but it's developed by Brian Tuckey out in Maryland from Tuckey Associates and the Jones Institute, where this technique was developed. Basically what I'm doing right now is I find a tender point, like a Jones tender point like you'd find in any other area, and I'm fascial gliding the soft tissue in an inferior lateral direction, and as I kind of press over the tender point, I feel the tender point ease, and the patient will as well. And I also check for localized motion at the joint. In this case, this is the sixth rib, where the tender point is located along the axillary line, and on the anterior aspect, obviously. And I just check it out. Each hold is about 30 seconds, and that's how I do it. So that's the one release to it. How does that feel better in there?
Mm-hmm.
Okay, good. She's gonna have to say yes every single time.
Okay.
But yeah, so that's basically the technique there. And then I scan down into the ninth rib, which I'll come down a little lower, and what I'll feel for is that tender point, and she'll tell me,
Yeah.
I could feel on the right, and what I feel on the right side here is just the joint itself doesn't move as well, and it just means that there's a tenderness of the tissue that's in the area. The treatment for this particular treatment is just go a little bit superior lateral to the umbilicus, and you're going to kind of find the tissue in there. You get a bit of that tissue, and you fascially glide it toward the ASIS in that direction. And the minute I fascially glide it in that direction, I'll see very quickly that I could press over this joint, and I'll ask, how does that feel better?
Yeah.
Okay. I could also feel with my fingers on the right hand here if the tissue is moving better, and also if there's like a release of the tender point. Basically what happens is the tender point is a bit of a boggy sort of tissue field, and when you push the tissue in this fascial plane, which is going to be the inferior lateral direction, the tissue right away relaxes. So that's what you get when you start to do this sort of technique on that level. And I hold it for 30 seconds, and that's how I release this tissue out. So this is typically, because it's related to the lymphatics, what you'll find with what you're going to find with patients who have issues down here along this level is you're going to find that these are related to the intestines or the general viscera, and this particular technique here helps to treat those particular areas. And you'll find everything from lumbar spine pain to thoracic spine pain to just an area of the body that's not really responding to your treatment. So this particular area helps out a lot. Sometimes with our forward neck and cervical spine patients, you'll find that their abdomen area is tight in through here, so they're kind of flexed in this area in general, and that all the tissue in this area, especially along the fascia, gets tight, and that's why we treat that. We just look for these tender points as diagnostic points to determine exactly where you need to go. So for example, she didn't have one on this side, so could it mean that it's a little more tender on this side? Does it mean that there's more of an issue on this side? It's possible, but the diagnostic point that you're looking for is based on the idea that it hurts and is painful, so you just treat it. And you look for the worst ones first, as you do with any other strain counterstrain technique. This is a little example of strain counterstrain for the lymphatics, developed again by the Jones Institute and Brian Tuckey. And I'm Dr. Samaretti trying it out.